This is Dr. Epstein with a patient who is 1 day out from around 1,400 FUE grafts, which we focus right in his frontal area. He had a prior transplant procedure, a very small one, a strip procedure, has a small donor site scar that was done elsewhere. He's a little bit challenging because he's mostly of Afro-Caribbean ethnicity. So those hairs are always a lot curlier, and he does have some of that classic hair. We focused on filling in here. He's 1 day, not even a full day out, and here he is. You can see this is around 1,400 grafts. You see all these grafts. Mostly these are 3 and 4 hair grafts, which is for good density. You see the hairline we created. And as I said, the donor hair was done by FUE, and he's already, this is his old scar, but you can see, or you can barely not see anything at 1 day out. Basically his donor hair is pretty much healed up. The way we're doing FUE, FUEs now are, we're not showing them, right? Okay, cool, you're fine. The way we do FUEs is we use a combination of different punch systems or FUE systems. I've started using more and more of the WAD, W-A-W system. It was developed by a colleague of mine in Belgium. And what's nice about it is it's called a hybrid punch. It's got a sharp tip, but then it's blunted. So if you picture these are follicles, and this is the punch, instead of it being sharp, which is what the conventional systems have, they can transect the follicle, this is more fluted. So what it does is it goes around the follicle, even when it's curled like his hair is quite curly, it actually, even though we push straight down, it's blunted so it doesn't cut the follicle. It's sort of the same concept as almost like a cast cutter. Cuts the plaster, doesn't cut the skin. In this case, it cuts the surrounding fat and skin, but it doesn't cut the follicles. So even with this curly hair, we were able to get less than 5% transection. Literally, out of 1,400 grafts, I think there were literally like 8 or 10 that were not really usable. Everything else had 3 and 4 hairs, majority. Anyway, this is post-op day 1 from an FUE procedure. It's Dr. Epstein. Thank you, patient. Thank you very much.